Hi, I'm Dr. Mike, and we're here to discuss post-rehab guidelines and tips for the upper extremity, particularly the elbow. What I have here is an anatomy model showing you the forearm and also the wrist and hand. What I wanted to discuss here real quickly were the locations of both tennis and golfer's elbow. And you'll notice here we have a right forearm. We also have a section of the elbow and also the wrist and hand. You'll notice here along the lateral aspect of this forearm we have the large major wrist extensor muscle. Now you'll notice where this muscle attaches here in the wrist hand area, it also comes up and attaches here. Here's our muscle belly, which attaches into this common extensor tendon. Now I'm going to show this to you here on my forearm, and you'll notice when I extend my wrist here, you'll see these muscles pop out. When I extend my wrist, you can see these muscles contract here, okay, every time I extend the wrist. This area here where all these muscles come together is called the common extensor tendon. That would be this area right in here. Now you'll notice the muscle actually blends into the tendon, and the tendon then inserts into the bone. This is a common area for the development of bursitis and tendinitis. The tendinitis would be called tennis elbow. There's also a bursa that sits under this muscle. It actually protects the underlying bone so that the muscle doesn't rub directly against the underlying bone. So there's a bursa sitting underneath, and when we have a bursitis here, that's what's going on. Now the interesting thing here is when we have pain in this general area, it's called tennis elbow. And that tennis elbow pain develops whenever we do anything involving wrist extension. So with tennis elbow, we see it along the lateral aspect of the elbow here. Golfer's elbow, on the other hand, though, involves the medial aspect of the elbow. Now, when I now flex my wrist, you'll see that these muscles come into a common tendon along the medial aspect of the elbow, and this is called the common flexor tendon. Now, that common flexor tendon is right here. So when we see people with golfer's elbow, little league elbow, particularly in young boys and girls trying to throw curveballs, that inflammation occurs right here where the muscle belly intersects the tendon, and the tendon in turn inserts into the bone. So this is a common area for inflammation, and this is called medial epicondylitis, or golfer's elbow, or little league elbow. Again, along the lateral aspect here, this will be tennis elbow or lateral epicondylitis. I just want to take some time just to show you where those conditions are occurring so you truly have an idea that these are actually occurring in the interface between the muscle, the tendon, and the bone. So this entire area is involved with lateral epicondylitis, and with medial epicondylitis, this entire area is involved. Just quickly to note here, these yellow items that we show here are actually nerves. And you'll notice with these nerves, they actually pass down into the wrist and into the hand. So they're very important as far as providing innervation for the entire forearm and also into the wrist and hand.